You're listening to the Doctor Is In podcast, brought to you by MartinClinic.com. During the episode, the doctors share a lot of information. As awesome as the info may be, it is not intended to diagnose, cure, treat, or prevent any disease. It's strictly for informational purposes.
Hi, Dr. Martin here, and I want to talk to you today about an epidemic. Lots of epidemics going around, it seems, in health, but this is one that is incredible. I read this statistic recently, over 25 million people in the United States alone are on antidepressants. And a lot of those, that's strictly the adults. Now, we're not even talking about children who are on antidepressants. I remember when, I think it was Prozac that came out in the 1970s, and it was supposed to be the great miracle drug for depression, but it was meant to be temporary to get somebody through a very bad period. But I get a lot of patients come in and they've been on Prozac or Celexa or whatever for over 25 years. Incredible. Never meant for that. Anyways, we have a major issue in society today that is depression. And I just want to give you a couple of things that perhaps you've never thought of when it comes to depression, because I always look at the cause. Why do we see so much depression today? Not obviously, depression has been around as long as man has been around. But again, like I say, it's so much more common today, and I think that is, there's a couple of reasons for it. I think, number one, we live in a completely different world today. We are carboholics, we're sugarholics, that the average, North American, they don't even realize that they're consuming somewhere around 200 pounds of sugar a year, and sugar is as addictive as cocaine. It actually takes the same route into your brain as cocaine, and has a major effect on your brain because glucose, sugar, was never meant to be consumed to the extent it is today. So I think that the world has changed. We live in a different world. Stress, it seems, is much more prevalent. And by the way, I really believe that depression is the end result of anxiety. So I believe that stress, high levels of cortisol over a long period of time, you mix that in with, a bad diet, full of sugar, it changes it has a big effect on your dopamine, serotonin levels. These are your feel-good hormones. Now, I don't know if you knew this or not, but back in 1984, there was an MD by the name of William Crook, C-R-O-O-K, I believe, who wrote an article in the Journal of American Medicine and JAMA, and stated that he was finding that people that were depressed he didn't call it leaky gut. He called it, there was a big association between that and candida infection, yeast infection, a fungal infection, and leaky gut, leaky brain. It's amazing the connection, because you have more feel-good hormones in your gut, the serotonin in your gut, dopamine in your gut. You got a lot more of that hormones in your gut than you have in your brain. Leaky gut, leaky brain. And he wrote an article back in the 1980s, imagine that, talking about the connection between an overgrowth of yeast, leaky gut. And I mentioned to you the other day that in another podcast, or at least in another live video, talked to you about the connection between the overuse of antibiotics and how that creates a yeast infection inside your body. It's low grade, but yet it starts to spread and can go up to your brain through the vagus nerve and get across the blood-brain barrier, just like you have a barrier in your gut. You also have a barrier in your brain. And if yeast gets in there, it can be a factor in depression. That was known back in the 1980s. Of course, medicine never dealt with that. They, it's just antidepressants, and antidepressants are not meant to fix the problem. They're only meant to mask the problem. So you can imagine this is quite the issue. So causes: overuse of sugar, in my opinion, the high secretion of high circulating insulin because of the fact that we're carboholics, sugarholics. Second, leaky gut has a connection to the diet too, because yeast or candida needs sugar to proliferate, needs crappy carbohydrates. So this is an issue. Diet, leaky gut, overuse of antibiotics, I believe, have a connection there. And it affects your hormones, the feel-good hormones. Now, let me also say that generally, because if you're on an antidepressant, one of the things that antidepressants do is because they are they have fluoride molecules in them, they actually leach out your magnesium out of your body. So these are common deficiencies. I just want to talk about that for a second. Here is what most depressive patients suffer from, and they have a lack of magnesium. They usually have a lack of B12. They have a lack of vitamin D, and they have leaky gut, which would be a lack of probiotics. So those are very, very common factors. Low magnesium, low B12, low vitamin D, and not enough good friendly bacteria. The microbiome of a depressed patient is much different. It has been changed due to the overgrowth of candida, yeast, fungus. So how do you treat depression? Of course, from a natural standpoint, I like cleaning up the diet, going on a low carb, especially cutting out those sugars, high levels of B12 taken sublingually every day. I usually start off, depending on what we see, about 12,000 micrograms of B12. Go very high, get your levels, get a high level of vitamin D. You want to have optimal levels of vitamin D in depression. That's why depressed patients do much better in the summer than they do in the winter time, because of the vitamin D. So obviously, if you live in anywhere in, you're not in Florida or Arizona, you need to take vitamin D during the winter time. And certainly broad spectrum probiotics. So the other thing that I've noticed in men is that another factor is men that are depressed, they have low levels of testosterone almost invariably. And then the other one is in women is they usually have high levels of estrogen dominance and not enough progesterone. These are all things that can affect a person in depression. So you want to clean up the diet. You want to take certain supplements. You want to take magnesium. I like magnesium citrate, around 1,000 milligrams a day of magnesium citrate, even higher than that. For depressed patients, sometimes I'll put them on an even higher dose of that. And so these are considerations for depression, thinking outside the box when it comes to depression. So thanks for listening today. If you have any topics that you would like me to cover, then certainly send that along to us. And thank you for watching today.
You've reached the end of another Dr. is In podcast with your hosts, Dr. Martin Jr. and Sr. Be sure to catch our next episode, and thanks for listening.